Hello, everyone. Today, we're really excited to have Dr. Helen Chu from UW Medicine, a researcher par excellence, a trailblazer scientist, and an infectious disease doctor whose vision for population health has been a beacon for public health officials around the world during the COVID-19 pandemic. Thank you so much, Dr. Chu, for joining us today.
Thanks for having me.
Yeah, thank you so much. So, Dr. Chu, your focus has been on preventive interventions against viruses like influenza, RSV, and most recently COVID-19. Please tell us about your role as a researcher and investigator at UW.
So I do research on respiratory viruses. I study vaccines and treatments for flu and other viruses, including RSV and now coronavirus. And I've done a lot of clinical trials and also studies in the community.
Wow, that's great. And your work with COVID-19 is so inspiring for the community and for people across the world. So thank you so much. Your work is really amazing, and you're such an amazing role model uh, for kids, especially for kids who are interested in science. And uh, this pandemic has really shown us the power of science and what science can really do and how it can help positively impact the community. So, Dr. Chu, the COVID-19 variants are a source of fear for the community. So please tell us about the different variants, and are they in here in Washington State already?
Yes, so yes, the variants are here. So there's a couple of variants that you need to worry about. There's the B.1.1.7, which is the variant that's started in the United Kingdom and has been found here in Washington State. And then also there are two others, the B.1.351, which is the South Africa variant, and then the P.1, which is the one that was originally identified in Brazil. So those are all here in the United States, and it's ever evolving, but both the South Africa and the UK variant have now been found in the Washington State area, and I imagine the P1 variant will be here soon.
And Dr. Chu, recently we've been hearing a lot about the Johnson & Johnson vaccine and how it was recently approved. So how does this change the scenario? And what are some features of the Johnson & Johnson vaccine that really set it apart?
So the Johnson & Johnson vaccine was, I think, approved just a few days ago. And the difference between the J&J vaccine and the other vaccines is that it's only one dose. So you don't have to give two doses a couple of weeks apart. So it's much easier to get out to the general community. It's also easier to make and can be stored at temperatures that are easier to manage in most places around the United States and in other parts of the world. So I think it's probably going to make it much easier to get vaccines out to a larger group more quickly than we had anticipated before.
Yeah, thank you so much, Dr. Chu. I think that's really encouraging, and that's great news for the community and for people who are either worried about the vaccine or worried when it will be their turn to uh, go and get it.
Mm-hmm.
And with this type of virus, with COVID-19, I know that many people are feeling very panicked about the different variants. So how often can we expect mutations, and what are the implications for vaccine boosters?
So I think that the virus will probably continue to mutate. It's an RNA virus, and RNA viruses do tend to change over time more quickly than other types of viruses. But for viruses to mutate, they usually have to pass from person to person. And so if we do the things that we would want people to do, including masking and distancing and having good ventilation and washing your hands and all of those things, then those will keep the virus from transmitting from person to person. And so the rate of of spread of the new variants will not be as high as we've seen in other countries up until now. I think also with the vaccines that most likely those vaccines will be modified to be able to handle the new variants. I know that some vaccine manufacturers are working on that, but many are also planning to update their vaccines to account for the new variants.
And Dr. Chu, there's a lot of vaccine hesitancy in the community. There's a lot of misinformation out there, and many people are worried about getting their vaccine. So, what can you tell those people? What would you say to those people who are still hesitant to get the vaccine?
Well, I think so. I think some people are hesitant, and some people don't have access. And those are sort of two separate issues. I think there's certainly people who are worried about things like the safety of the vaccine, the adverse events after getting the vaccine, and whether or not things have been followed long enough to be able to say that they're safe in the long term. And those are all very legitimate concerns. And then there's another group of people who simply have not been able to access the vaccine because it is very hard to access the vaccine. And so they haven't been able to get the vaccine, despite maybe wanting to get the vaccine. So I think that we have issues in both here now. We have issues in getting vaccine out, and then we also have issues in people who are concerned about particular pieces of the vaccine. And so for those people, the ones who are concerned, I would say that there have been many clinical trials that have shown that this vaccine is safe up until now, that we're continuing monitoring, and that and then we'll continue to do so, but at a very, very large level with a lot of data that we're collecting at the national level to be able to find very rare events if they were to come up. But so far, there has not been any signal that there are any major safety issues with the vaccines as they've rolled out to large portions of the population.
So, in terms of vaccination, what are some good public health strategies that can boost vaccination rates?
In terms of what do you mean by public health strategies? Like vaccination clinics or messaging?
I would say both. Like, what are some things that like public health officials can do to help boost vaccine rates?
I think a lot of the reasons why people are not getting vaccinated right now is because of limited supply. It's not so much that there are issues certainly around being able to get information out about the vaccine safety, but right now the largest limitation is simply that we do not have enough numbers of doses of vaccine for the population as a whole. And I think that's something that will happen probably over the next couple of months. And once we get there, it would be great to start having more conversations about what is the correct messaging. But we are simply at the point right now where there aren't enough vaccines to get into the arms of the people who need them. So it's not so much an issue with public health messaging as supply and getting vaccines out to where it needs to go.
At this point with the vaccine here, what are some of the places that vaccinated people can safely visit? Can they go to like malls, restaurants, or other people's homes?
Yeah, I mean, I think that that's still to be determined. I would really follow the Centers for Disease Control guidelines on that. They haven't updated them yet to say what you can and can't do after vaccine. Right now, we are asking people to essentially do what they were doing before, which is continue to mask and to distance. And there's a lot of reasons for that, but one of them is simply that not that many people in the community have been vaccinated. And so most people are still at risk. And so if some people start unmasking and doing other things, then it creates, I think, a public perception that there's a certain behavior that's okay. And it's probably not until we get to a certain number of the community that's vaccinated. Once we get to 50, 60% of the community that's vaccinated, I think a lot of these guidelines will change.
That's really great to know, and it's really encouraging for people that haven't gotten the vaccine yet as well. So my last question is, what is on the horizon for your research in terms of COVID-19 and beyond?
So we're doing a lot of different studies. Some of them involve helping schools reopen. Some of them involve looking at the long-term outcomes of coronavirus infection and looking at how long people's antibody protection lasts and developing a better understanding of what leads to long-haul COVID. We're also doing work with a lot of different groups to look and see what happens when you roll out vaccine to the larger community and what impact that has on transmission of coronavirus in the community, and also on other viruses like flu, which we think of as more often the cause of seasonal epidemics. So I think there's lots of interesting questions to be answered still, and lots of work to be done, despite the fact that I think we are now getting to close to the end. Vaccines are rolling out. We're getting to a good place. But there's just even though we'll have vaccines, coronavirus is not going to go away. So I think that there are other things that we need to study and understand better, especially I think to prevent sort of another pandemic, and some of the things that we need to develop better infrastructure for.
Yeah, thank you so much, Dr. Chu. I think this is amazing, and it's great to hear about all the wonderful research that you all are doing. So thank you so much. This was great information for the community on vaccines and beyond, and what we can expect with the Johnson & Johnson vaccine and the new variants. So thank you so much, Dr. Chu.
It's a pleasure to talk to you, Mahir.